Indiana Senate District 21 is one of those places that tells the truth about the whole state. Because you've got communities that are growing fast, these that are holding steady, and communities that have had to fight every inch they've kept. And when state policy gets lazy or ideological, districts like this pay first. I'll last first. So tonight we're doing what we do best. Fewer slogans, more specifics. We're talking about the stuff that actually hits your kitchen table. What's happening to property taxes and rent? What's happening to public schools? What public safety actually means, and why it still feels like the state house hears lobbyists clearer than it hears you. And yes, we're going to talk receipts because vibes don't fix potholes. My guest is a Democratic candidate for state Senate who says her lane is practical solutions and community first problem solving. Shaped by her work as a social worker and public servant, let's get into it. Welcome back to Hold 'em Accountable. I'm Derek Holder, and around here we don't do political fan fiction. We do questions, facts, and follow-ups. Tonight, I'm joined by Kirsten Root, a Democratic candidate running for Indiana State Senate District 21. Kirsten describes herself as a social worker, public servant, and community advocate, and she's framed her campaign around practical solutions and public safety, with a big emphasis on hearing directly from residents. And this race matters because District 21 has been represented for years by Republican Jim Buck. Kirsten, welcome to the show.
Thanks so much, Derek. I'm happy to be here.
District 21 includes fast-growing suburbs like Westfield and long-established communities like Kokomo and Tipton. What do you see as the shared interests that unite this district, and where do you think state lawmakers have failed to recognize them?
Yeah, so this district is definitely a wide range of demographics, but I think at the end of the day, everybody is wanting the same things when they look at their families and just what they want their quality of life to look like. The biggest things that unite us are, of course, things like affordability, groceries, childcare, all of that. I think that's the simplest answer. But looking at quality of life, just having jobs that are equitable and have decent pay, have some sort of benefits that benefit people. So healthcare, continued education, anything that is going to provide long-term outlooks. Everybody is looking for healthcare. Even if you live in Westfield, you can still struggle to find a doctor. But especially in rural communities, accessing mental health care is impossible for most people. Outside of that, public safety has been a huge thing that I feel like has been left behind. I've been meeting with law enforcement, fire, public works, all of the different areas, and I've heard across the board that they're not getting the support that they need. And they're having to cut funding, they're having to cut programs that are detrimental to the communities. And last thing is quality schools. Everybody wants their kids to have a good education and not have to be worried about if they are going to get the same education as somebody in Westfield, if they live in somewhere like Roosevelt or Tipton.
Kokomo has lived through manufacturer booms and bust, while Hamilton County has seen explosive growth. How would you approach economic development policy so it supports good paying jobs without leaving rural and post industrial communities behind?
Yeah, so I think one way that we've been failing as a state is we're not looking at things as a whole. We get really wrapped up in areas that are growing quickly, like Carmel, Westfield, Fishers, which is great. It's really exciting for those communities, but those funds need to be spread out through the state because our residents aren't just people who live in big cities, and that's not the heart of Indiana. It's our rural communities at the end of the day. So I really want to focus on if companies are getting support, state support, they need to be held accountable and there needs to be living wages. So if something like Starbucks is coming in, just as an example, this isn't bashing Starbucks, but they need to be giving better benefits than what would be expected of a small startup shop because they have the fund. They have the funds. That's why there's 12 in every town, it seems like at this point. We also need to be expanding apprenticeships and paid training and trades. I know that as manufacturing is shifting a lot, there is a lot of concern around where people are going to be working because they can't rely on social benefits, even if it is deserved. So there needs to be resources for people who are needing to perhaps learn a new trade later in life. whether they want to or not, whether it's their fault. There needs to be options made available. And that can look like strengthening partnerships with places like Ivy Tech so that people can get that training and not be going into hundreds of $1,000s of debt just to feed their family. Additionally, we need to be investing in things like broadband. I live in Sheridan and our internet goes out pretty frequently. And my husband works from home. So, like, personally, we'll see in the Facebook group, internet's been out 3 days. What are we going to do? And for people who are working from home, from people who are homeschooling or just are trying to access information about their healthcare, that's not realistic. And it leads to people having even further gaps in the services they're receiving and jobs that they can qualify for. Um, Last thing is we need to be working on state funded work, prioritizing unions. There is no reason that the state should be doing anything outside of union work unless it's just not available. But I find it hard to believe that there's an industry where there isn't a union somewhere in the state. That there should be incentives for us to continue doing that and to make sure that we are being leaders for other companies throughout the state as this is accessible, it is possible.
Rapid growth has driven up housing costs and property taxes, especially in places like Westfield and Sheridan. What specific actions would you support at the State House to protect working families and seniors from being priced out of their own communities?
Yeah, this is something that I've heard a lot. During one of my internships for grad school, I was with Westfield Fire Department working with seniors who are utilizing 911 a lot because they don't know who else to call. When they have a fall, when they don't know how they're going to pay their rent, they're consistently asking, what can I do? So for people who are renting, and that can be any demographic, right? I would support rent controls to keep landlords accountable. There's no reason that somebody's rent should be going up $400 or $500 in a year. That's absolutely insane. So limits should be no more than 3% or 1.5 times inflation. But I'd also be open to a rent freeze depending on where we are in the state at that point in time. For homeowners, I want to expand property tax credits. So that's especially for demographics like seniors, veterans, people where there's an established additional need. And that can look like people who are maybe victims of domestic violence and all of a sudden they've had to have somebody leave their home and they're on one income now. Additionally, I want to limit increasing assessed values for homeowner occupied homes because I hear a lot that I can find a rental house, but I can't afford to buy a house. And then you look on Zillow or something and there are hundreds of listings and these houses are just sitting empty when this is a area that there is a lot of growth. There's a lot of people wanting to come work here, live here, but we can't afford to live here. Last thing is reducing the cost of staying in your home by incentivizing home energy upgrades. So making sure that people have the funds to be able to make improvements. I've ran into a lot of people who are like, I love my home. I don't want to leave, but my windows are leaking. I can't afford the utilities anymore with all of the utility changes going on. I can't afford it. So now they're having to go in housing that is an hour away from home or just not servicing their family anymore.
From Tipton to Roosevelt, public schools are often the backbone of the community. How do you view the current balance between public school funding and voucher programs? What changes would you advocate for as a state senator?
To put it as nicely as I can, the current balance is trash and non-existent. And and I genuinely mean that is putting it nicely. It's a complete disservice to our taxpayers, to our kids, and to our state because they deserve better. Our public schools job is to serve every single child and to make sure that we're meeting their needs regardless of income, zip code, of where they came from originally. We should be doing everything we can, or any like disabilities present. So we should be increasing funding for Title I schools and improving funding for publicly run magnet schools. I know that's not available in every community, obviously, but that is important for our more urban areas. I want to completely get rid of charter schools. I think they're the worst mistake that we've made here in Indiana regarding public schools. Or if it's not the worst, it's at least the top 5 because the money that we're putting into these things should just be going into public education. Everything everyone hates about public education is a direct result of these changes that have happened. I want to raise teacher pay to at least $60,000 with a classroom allowance, and we need to be diversifying our funding so that it's always going to be set aside for aides, counselors, support professionals. A teacher's job is to teach. They shouldn't be having to do everything else alongside that role. We also need to be offering universal free lunch. It's cheaper to just feed our kids than to be not feeding them and making it even harder. I mean, I know how cranky I get if I don't have a snack at some point throughout the day. So trying to look at kids who are doing their best, like there's no reason not to be feeding kids. That shouldn't be controversial. And then we should also be having universal pre-K. That shouldn't be a luxury. It's a basic necessity. Data backs it up. There's no reason we shouldn't be educating our kids more. And finally, changing our funding structure so that it's reflecting rural and working class communities. Just because you live in Westfield doesn't mean you should get a better education. As a state, we need to be doing better to take care of everybody. And I think that is everything I can think of at the moment.
Many residents in District 21 still face long drives for care or struggle with affordability. Do you believe Indiana should expand access to healthcare through state level reforms? And what would that look like in practical terms for this district?
Yes, yes, 1000% yes. So when I was in mobile integrated health, we frequently were coming up to Sheridan because Sheridan doesn't have the resources that Westfield has. So sometimes we would be driving 45 minutes to go meet with somebody because there isn't DMS, there's no hospital, there's nobody to come serve them. But that shouldn't be an answer. It shouldn't be one city having to go 45 minutes when those resources should just be available everywhere. So it looks like investing in community health centers, school based clinics, and mobile health services. When I was again, in grad school, I also worked at the IU Free Clinic in Indianapolis, and we had a great partnership in the city. It was a meeting of the med school, nursing, law school, social work, pretty much every school IU and Butler have to offer. And we were able to provide those services for free. And it's experience that students already need. So it's possible and it's doable. It just takes a little bit of time and effort. We also need to expand loan repayment and scholarships for nurses, mental health clinicians, and PCPs who are committed to rural care. A lot of the rural communities can't afford to pay what someone in Westfield might be getting paid. So, like Tipton, Richeville, parts of Kokomo, they just don't have the funds. So, the very least that we can be doing as a state is helping pay off those student loans or providing better expertise. It also looks like adding clinic experience, though. Our students don't just live in Indianapolis. I mean, they could live up in Tipton and be driving in an hour and a half to go to med school down in Indy. So why don't we set up clinics where they can get their experiences up north and be able to serve that community? Additionally, we need to be expanding funding for mental health and addiction treatment. While I've been meeting with law enforcement, the number one thing that I hear is our jails are the biggest mental health facilitators in the area. And that's not Republican, it's not Democrat. I've heard that from every single officer I've spoken with because that's not their job and that shouldn't be the expectation. So we need to be making sure that those resources are available and that includes broadband, making sure that we can have telehealth in communities, but also having in-person services. So what we were doing in Westfield was it was a partnership with the fire department, and there was a social worker teamed up with a paramedic. We would go into the community, provide mental health support, provide education around what they were needing, from healthcare to how to navigate Medicaid, and just getting anything that they needed. So syringes, any sort of harm reduction, as well as funding when it's available, setting them up with their local trustees. Those are all very, very doable and completely integrated with healthcare as well. Finally, expanding funding for our health departments. I believe Hamilton County had nearly a 40% reduction in their budget. I need to double check that number, but that was the last number that I was told. And so they're having to cut a significant amount of their programs. And it's things like vaccines, STI testing, maternal and infant support. These aren't things that we can get rid of. This is how people die. And that's not what we're paying taxes for when we have giant surpluses and can afford to build a helipad at the governor's house. We can afford to take care of kids.
Growth brings opportunity, but also traffic, strained utilities, and environmental pressure. How should the state help fast growing areas like Westfield and smaller towns like Roosevelt plan responsibly for the future?
Yeah. So growth is something that not every town wants, and that's okay. And I don't think our smaller communities should be punished for that. But going along with that is ensuring that they have the tools to be able to continue the work they're doing. So I think part of that looks like having partnerships where maybe Roosevelt doesn't have somebody that can do all of the storm drain planning, who can do any surveying that's needed, but we can do that from the state house. And maybe we have somebody who goes on loan and can be used in the communities when they're needed because it's not going to take all year to figure out adding one intersection in a small town. So, using services that are available to the entire state instead of making it just based on the cities, because that's what our taxes are for. Capacity planning also needs to be a part of the conversation. So, before large developments are being put in, we need to put in state support for water, wastewater, and stormwater upgrades. I know that we get a lot of flooding here in Sheridan. We have seen that this week with our snow melting, and I'm sure that's not just in our area. I mean, I live in the biggest neighborhood in Sheridan. It's a huge new division, right? So theoretically, we shouldn't be having these problems, but we still are because the resources aren't there and the community doesn't have the expertise that they need or the funding. And that's not their fault. They just are expected to take on 1,000 different roles because they're a small community, and that's not realistic.
Rural towns often feel overshadowed by suburban growth. How would you ensure that places like Sheridan and smaller unincorporated areas are not treated as an afterthought in state policy decisions?
Yeah, so I think a lot of that is that we need to readjust our funding formulas so that they are not only rewarding growth. Like I said earlier, every town deserves to do what they want to do because not every town wants to be the next Westfield. A lot of our programs currently unintentionally favor places that already have the staff and capacity to have new projects. And so grant money is being given to them, but realistically, they could have made up the money some other way. So I think that our grant programs need to have money set aside for rural areas, like let's say 30%, just to give a number where that money can only be used in populations that are under like 10,000. Just I need to do more research as far as the data goes to figure out what those numbers could be, but just as a kickoff point. Additionally, there needs to be assistance for rural areas that are wanting to get those grants because places like Noblesville, Westfield, Fishers, they have people on staff who that's their sole job is to write grant applications and understand that process. That's not realistic for places like Sheridan and Richville. And it shouldn't be a necessity that you have people who have specialized in this for 20 years. So simplifying the process, helping people get through that, and then just as a legislator continuing to show up and ask questions. I think it's important to be out in rural communities and asking what is being missed because I don't live in every town. So going out, having actual office hours, spending time in the community and being transparent about what changes are coming, what we're considering and saying, "Hey, how's this going to impact you guys?" instead of just making assumptions.
What role should the state play in expanding vocational training, apprenticeships, and partnerships with local employers so students in District 21 can build careers without being forced to leave their hometowns?
Yeah, this is one that I am really excited about. So I'm originally from LaPorte, Indiana. I did our AK Smith program to get my CNA in high school. And that was a really cool opportunity. And when I moved to Indy to go to college, that's not available to everybody. We could get like cooking, welding, all of these certifications, and that's not the norm. And that's not fair. I mean, LaPorte's one of those mid rural areas where you either live in town or it's a 45-minute bus ride. I had the 45-minute bus ride. And so I'm having an hour and a half to go to school in the morning to do this extra opportunity. So the state needs to be treating it as a core piece of education. So that involves providing additional funding with modern equipment, updated labs, transportation support, and giving instructors competitive pay. I know that this isn't something that can be offered in every town necessarily, but we can set up transportation to where we can have collaborations and be able to offer this to students. We should also, as a state, be offering coordination placements so that students aren't having to figure it out on their own. So, when I say that, I'm especially referring to like adults who want to get this additional training. Somebody is maybe 25, they finished school, didn't go to school, but they're like, I want to go learn how to do this new trade. That's not just something you know. If your parents aren't already in an industry or you don't know somebody, you don't know where to go. So then you just keep doing the same thing. We also need to be making credentials count towards graduation and college credit by expanding dual credit and industry certifications. So people already have those. It shouldn't be an extra step that they then have to take. Just build it into the curriculum and it'll give people the resources that they need to do better for their families.
Many Hoosiers feel that the General Assembly is more responsive to lobbyists than to constituents. What concrete steps would you take to increase transparency, accountability, and trust in the state government.
Yeah, so I just want to say snaps for that because it's true. Our legislators aren't listening. And so, as a legislator, I think that we need to be following Ohio's lead and working as year round legislatures, or as a year round legislature, excuse me, because our state doesn't only run a few months out of the year. The governor is working 20 every single day, allegedly, and we should be doing the same because why? There's just no good reason. There's no good reason. So I think that trust starts before the state house. We need to be giving better engagement for students to understand what our state house process looks like and how they can be a part of things. What does it mean to be a legislator? What does it mean to go testify at the state house? And how do I do that? You shouldn't be expected like, oh, I need to have a PhD and that makes me important enough to go. I want to hear from everybody because those aren't the people who run our communities. Our farmers do, our people who work in the plants do, our people who work at Dollar General. I mean, they're our biggest supporters, right? Is Dollar Generals around here. So a part of that is transparency, teaching those skills to students and also to adults and having that available at places like libraries, houses of worship, whatever that looks like for that community. They'll know it better than I do because I can say every library should have this kind of class, but that's not always realistic. Where is it accessible? When's it accessible? Additionally, we should be banning lobbyist gifts and tightening the ethic rules. There needs to be strict accountability. And I don't want to hear that somebody just took $25,000 from some Trump supporter, and now they are going to be running our state. I mean, that feels like common sense to me. Um, there needs to be more transparency around how we're doing our bills. A lot of these things are just getting pushed through last minute. There are being amendments made that are incredibly detrimental to the communities, and people don't know about them. Just last night in Howard County, Joe Calzak was talking about a bill that would have been beneficial to veterans, but then they're throwing in different kinds of subsidies and things like that when that has nothing to do with a bill about veterans. So having everything be clear, plain language, the community is being notified about it, and there actually being a timeline established where people can give their testimony and have to be heard.
Finally, what distinguishes you from other candidates in this race? Why do you believe that this moment calls for the kind of leadership you would bring to Senate District 21?
Most of my career as an adult has been fixing things after they've gone wrong, or fixing things where prevention mattered and could have been utilized. I have worked in child safety. I was the person showing up at 3 a.m. because of a domestic violence dispute. Nothing scares me at this point. Somebody in the state house who is going to be bullying me or trying to tell me that this isn't going to benefit the state, they can't say anything to me that's going to make a difference. Because at the end of the day, I'm going to tell you, our constituents matter, and I'm going to roll up to their little town across the state and be knocking on doors and saying, hey, your senator's not supporting this. Have you talked to them about that? Because you should be. I am honest. I will tell you if I don't know something, and I will figure out the answer. I'll put in the work. I'll take the time because I don't know everything. That's impossible. And I am not going to sit here and come up with an answer when I don't know what you're talking about. It and I think another big thing is like I'll walk away when it gets to a point that I don't feel like I'm benefiting people. I left DCS after I realized I was burnt out. I'm not doing the best by my kids. I'm not keep giving 100% anymore because I've hit my point. And I think that's a really important skill to have. It's not something that's easy. It takes a lot of reflection. And that's not something I'm afraid to do at this point. I'm also grassroots. I'm independent. I'm not taking corporate money, and I'm not afraid to challenge the status quo. My supervisor from every job I've ever had will tell you that. Just because we've always done something a certain way doesn't mean that we need to keep doing it. I think right now people are asking for change. They're asking for bravery, practical solutions, and things that are really going to make an impact. And I would heavily encourage that as a legislature, if I'm not doing that, people should be holding me accountable and asking what the hell I am doing.
Oh, hi there. Do you live in Indiana? Are you watching this video? Come on in. I'm Blythe Potter. I'm running for Secretary of State. I'm a veteran, small business owner, a mom, and a lifelong Hoosier. I'm building a grassroots campaign focusing on talking to the people, not the establishment. So help me spread the message that Hoosiers deserve better from our elected officials. Oh, hey, before you go, introduce yourself in the comments and share this with a fellow Hoosier. Bye now.
Right. We've talked about priorities, policy, and what Senate District 21 needs moving forward. Now it's time to shift gears. This is the part of the show where we stop circling the issues and putting some cards on the table. I'm going to read a series of statements. For each one, you've got two options. Hold them if you agree or support it, fold them if you don't. No speeches, no hedging. You can explain after your answer, but the first response has to be clear. This isn't about trapping you. It's about giving voters a clean snapshot of where you stand. Are you ready? Indiana should put a pause on expanding private school vouchers until public schools are fully funded.
Hold them.
Healthcare access is a state responsibility, not just a market problem.
Hold them.
Indiana lawmakers should repeal near total abortion bans and restore medical decision making to patients and doctors.
Hold them every day of the week.
Indiana should expand vocational training and apprenticeship programs as aggressively as 4-year college pathways.
Hold them.
I want to thank Kirsten for coming on the show, for answering tough questions and putting herself out there in a race where public service still means showing up, listening, and taking responsibility for the consequences of your ideas. Running for office isn't easy. It's uncomfortable. It's public. And it's a commitment not just to winning, but to being accountable to the people who live in this district every single day. Whether or not you agree with Kirsten on every issue or not, engaging with voters, laying out positions clearly, and being willing to sit down for real conversations matter. This is how democracy is supposed to work. And to the folks watching and listening, this race affects your schools, your roads, your taxes, your health care, and the direction Indiana takes next. Don't tune it out. Don't outsource your thinking. Ask better questions than the mailers do. So stay informed, ask questions, and as always, hold them accountable.